Well, good afternoon, everybody. Welcome to the COVID Weekly Roundup for CAF. This is going to be a weekly series that we're going to start doing. We're going to try to do this every 1 o'clock on Friday afternoons as a roundup to try to cover stuff that happened during the week. Gosh, there's a million different pieces of information that we all have to consume as we go through a week. And we're going to cover some of the stuff that's come out this week, try to explain the AFLs that came out, because there's a lot of confusion that was started with that. We'll talk about some of the staffing issues we see in the state for areas that have large community spread of the coronavirus, namely Riverside, San Diego, Los Angeles, Santa Clara, and maybe a few other counties up north. All seem to be struggling a little more than the remainder of the state. But we'll talk about those staffing issues because we anticipate the staffing issues that we are seeing in those counties, more than likely they're going to be replicated in the other counties at some point. So we'll talk about PPE, what's the status of PPE in the state, how likely we are to get resupplied for those PPE resources. What a week, let me tell you. So, and then we also have a guest speaker as well. And we'll get to that at the end, but Jocelyn Montgomery, public health nurse, and many of you know her as the retired director of clinical affairs for CAF. She'll be joining us as well. So how do we get started? Let's cover the first AFL here, because this one is the one that we realize brings most folks consternation, or at least one of the most confusing ones. So if you've not seen it, this AFL essentially talks about guidance for how to transfer residents with suspect or confirmed COVID into skilled nursing facilities. So this is the state's position. The state has made it very clear that this is what they consider the minimal standard, but if a local public health department chose to defer from this, they certainly could do that. They have the authority, at least in public health. The Department of Public Health believes that the local public health departments have the authority to expand or contract this as needed. So with that being said, this has been pretty clear across all county lines that patients with no clinical concern for COVID-19 may be transferred from hospitals to SNFs following usual procedures. Now it goes on to say that SNFs are not required to ask the hospital for a negative test for readmission of a resident that has no clinical concern with COVID-19. That is the official position. So if you've sent somebody out, whether it be for testing or you sent them out for another reason, we're not supposed to prevent those folks from going back. That's what the guidance from CDPH says. If you look at the guidance from CMS that came out this morning, it does say that if we're doing that, their recommendation is for any admission, any readmission, is to treat those folks with contact precautions. I realize that PPE is at it's really hard to come by, and most of you have converted to conservation of the existing PPE that you have in stock. My suggestion is to continue with that. It's a little bit in conflict between what public health wants you to do and what CMS says needs to be done, or what should be done, or what they recommend to be done for each admission and readmission. I think the easiest way for us to be able to do this, and we're going to get to this, is how do we coordinate our ability to help with the local counties? We're going to talk about that in a second, but the reality, guys, is these folks are going to come. The question is, are we able to do that? So there we go. I'm sorry, the slides move forward just a little bit. So when we take a resident, what are the transmission-based precautions that we need to follow in order to protect both the residents in the building, but also our staff? This is what, when they say transmission-based precautions, this is what the folks should be wearing: a face mask or respirator, gown, gloves, eye protection. Personal eyeglasses are not considered adequate eye protection. I've had a number of people ask me about that, but certainly the eyes are a method of transmission of this disease. So you want to protect your eyes from folks that are COVID positive for sure. Airborne isolation rooms are not required for this, but I have seen guidance that when they're talking about cleaning out a room after a COVID positive person's been in it, it's there's a suggestion for a minimum number of hour changes to go through that room before you either reoccupy it or you go back in to clean it. So those are available on the CMS or the CDC website as well. There's going to be a link on here that you guys can refer to as well. So I realize this is a ton of consternation. We are actively negotiating with the Hospital Association and the Medical Association to come up with solutions from the provider side, because we don't know that the local public health departments have the capability of being able to manage these events, where they have a coordinating center that's calling each SNF to see, have you cleared out space? How many patients can you take? Do you have enough PPE? Do you have enough staff? CDPH has said that they want the hospitals to confer with the local health department and the local health department to confer with the facility that they're able to accept these folks. We don't know if that's happening because CDPH has not asserted authority over the entire operation and have deferred all of this to each local jurisdiction. We have 61 of those in the county, and we're not able to see how well some counties are doing or how poorly they are. So my suggestion, at the end of the video, there's going to be an email address that says info@caf.org. I highly encourage you, if you have a county that has not reached out to you, to get an idea of what your capability is of dealing with a COVID or a suspect COVID patient in your building. We want to know about it because we want to work with them to help them identify people that can help. Because at this point, folks, if we're not proactive about how we do this, these folks are going to come in mass and we're not going to be able to do it. And they're going to come 1 or 2 or 3 into a building and it's going to spread because we're not able to assign consistent staff or we don't have PPE. And that's going to exacerbate the problem because we're going to send 40 or 50 people back to the hospital after that. So we really want you guys to let us know if the counties have not reached out to you. If you have the ability to convert or wing or award, we'll talk about what that looks like. Have you thought about staffing and PPE? We're going to ask you guys to kind of figure that out yourself and let us know what your capability is of assisting, and then we can forward that information on to the respective counties and make sure we get to the right person anyways. So when we say that you're going to take somebody, that means that you understand that there's going to be a period of time when you need to maintain these transmission-based precautions. So when you look at the stock that you have of PPE, you need to be able to kind of forecast how long you're going to be able to keep that. There's no definitive guide on how long some of these folks stay contagious, but we do know that the recommendation is that in the interim, while they're symptomatic, anytime healthcare workers within 6 feet of that person, suspect or suspect case or a symptomatic case, those folks should be covering their mouth if a healthcare worker is within 6 feet of it. So just some clarification on what this looks like for transmission-based precautions and what the allowance is for acceptable alternative PPE. So they're saying that we understand that N95s are not some of you guys may have some, and some of you guys may have none. And for those that have none, an acceptable alternative PPE use is to use a face mask rather than an N95 respirator. All right, so how do we set up space within our facilities in order to be able to deal with this? There are a ton of recommendations, so many that I couldn't cover them in a 1 hour thing, but I wanted to connect you guys to the CDPH all facility letter, which essentially allows us to do our own alternate care sites, which means that you have the authority, the legal authority to transfer residents out of rooms in order to clear out a wing. In order to do that, my suggestion is to get an idea of what the county actually needs and how many facilities in the county stand ready to support this. The reason why I say that is I don't want you to proactively move folks if the county hasn't identified that they need the space in your building. We want to, restrict the amount of movement for folks just in case there could be issues that we may make more complex by moving non-COVID residents. So first, let's find out what the county's need is, and if you can give me what your level of ability to help is, I can send that to the county, and we can get an idea from each county realistically how many beds they're going to need. My guess is, folks, you've heard the news from the governor that said we were 50,000 hospital beds short. There's currently 78,000 hospital beds in the state of California or thereabouts. It's a rough number. They're anticipating a 50,000 bed surge above that 78,000 bed capacity. Those beds are going to have to come from somewhere. We've actively encouraged the state to staff and open up alternate care sites for the disposition of these COVID folks. And our recommendation to the state and to the counties is to use those as the primary source for COVID positive people. But even if we do that, we're still 10 or 20,000 beds short for this coronavirus for folks. And when these people leave the hospital, they may not be ready to be discharged home, and they may need some long-term care, 2 or 3 weeks to get their strength back before they can go home. And that's where we're going to have to play a part in that role. If there's 20 or 30 or 40,000 people that all need long-term care after this, at some portion of this, we're going to have to play a role. And so how do we do that in the safest manner possible without putting the life and safety at risk of the existing residents we already have? I know this is a tough time, and the state has not essentially said we're in crisis standards of care, but we're pretty close to that right now when we're determining space of where we're going to put these folks. So with that said, I want you to very seriously read those infection control recommendations on how to define a space, how to staff the space, PPE that's going to be required for that space. My suggestion is with staffing is if you guys have all your staff showing up, that's great. But I'm here to tell you 40 or 50 people are going to get called out of a building if you have a suspect COVID case, because they're all going to be put under investigation. And so when that happens, how are you going to get people to staff that building? And the areas that you have set up and identified as your COVID wing or COVID ward, we've got to get to the point where it's consistent assignment with the staff that are working in there. And the staff are aware of the risks that they're going to have to face. And if possible, to isolate themselves at home so they don't get their family members sick. It's a terrible thing to ask our staff to, it's a really big burden for all those folks to bear, but we have to be honest with them that even if you go work in this building and you get COVID, can you work even through this? If you're well enough to work, can you come to work? Those are the conversations we need to understand, because if you open a COVID ward and your staff get infected, you want to know that you can still staff it, or that the county is set up to send you staffing resources to staff that long term. We're working on, financial reimbursements and all of those other things. CAF is actively advocating on your behalf at the state level to figure those things out. This is an incredibly difficult time. I think each one of us is going to have to make some sacrifices to make this happen. That includes with our staff, and we've got to explain that to them. And it's been very difficult for us to listen to your frustration with how this thing is run. And we're doing everything we possibly can, and we'll bring this to you every week. And I apologize for getting emotional there. So when I say our people and staffing, a number of issues that we've run into, and maybe you've not run into this, or maybe you've come up with a solution for this, but physically getting to work at the outset of the stay-at-home orders was difficult. Hopefully most of you guys have created a letter or used a template letter that CAF has created as a authorization to get you past any checkpoints that the police or other law enforcement agencies may set up. Just to clarify, everybody that works in a skilled nursing facility or an intermediate care facility is deemed essential. You are part of emergency support function 8. And so anybody that works in support of the operations of one of those two types of facilities is considered essential. I realize there are some legal questions as to whether it clearly said that in the guidance document from the governor, the governor's order. I think it's pretty clear that our folks are essential under the order. So alternate staffing strategies, what is feasible? I think at this point, we've moved to everything we possibly can in turn, as well as every registry we can possibly find to get folks. There was a governor's order that talked about staffing, talked about expansion of what folks can do under their licensure categories. I'm not an expert in workforce or those legal matters, but we do have staffing resources, not staffing resources, but we have a workforce grant, and the folks that work on our workforce grant are actively trying to find staffing help wherever we can get it, through traditional means, non-traditional means, whatever we can do to do that. So, and then the last part is honest about the challenges. I think Jocelyn's going to talk about, how we take care of our staff and some of those other things, but we want you to be able to be realistic with your staff about what they're facing. We've actively tried to find other resources where we could have a COVID only building and have the staff stay at a hotel or something like that, so they didn't have to take, potentially get sick and take it home to their families. And we're still working on that. I know the governor has identified a bunch of hotels that would be used as staffing for the alternate care sites, the larger field medical spots that you're seeing being set up around the state. We're asking them to do that as well. The other thing I wanted to mention, and I failed to mention about the expansion of our bed space. The CMS has said, we want you to, have a wing or a ward, but what we don't want you to do is we don't want you putting people within 6 feet of each other. So if you do that, this is not a traditional surge where we're going to reduce the amount of space in between people so that we can get the most people we can in a building. This works the opposite way. We want to make sure whatever space we have for that if these folks are just suspect COVID people, we want to make sure they're 6 feet apart at a minimum, and there's some kind of barrier in between the patients. So if you're thinking about, man, gosh, I'd use my activity room or this other space within my building, and I can just turn that into COVID. When you do that, just think about that. We don't want you keeping them more than 6 feet apart. The other part of setting up the space for one of these things that's in that link, and it talks about having a separate entrance or some kind of physical barrier for how you divide off that section. So when I look at like a wheel and spoke model of a traditional skilled nursing facility, if we think about a wing or maybe a smoke compartment or something like that, some kind of physical divider that you can divide off with a separate entrance and exit, and have staff consistently assigned to that area, that's going to give you the best opportunity for success and making sure this doesn't expand to other folks in the building. I will say that the newest CMS recommendations that came out just this morning, I didn't have a chance to attach them to the document, but it is posted on the CAF website under that resource that I shared at the beginning, the caf.org/coronavirus, I think. I'll have to go back to the first slide to look, but in any case, that guidance document is on there. It essentially says we should be considering any admission or readmission. I don't want to get this wrong. Let me read the exact language from the thing. But essentially, if possible, isolate all residents, including readmissions, in their room for 14 days until their status is known, if they haven't been tested. So if you've sent somebody out to the hospital and the hospital sends them back to you without testing them, their suggestion, CMS's suggestion, this is from CMS, says, if possible, isolate all admitted residents, including readmissions, in their room for 14 days if their COVID status is unknown. So their suggestion is, even if you don't know and these people haven't tested, you should keep them in their room for 14 days until you can see if symptoms develop. So, gosh, I don't know where we're going to find all this PP and where we're going to do all this stuff, but it certainly seems like public health and CMS are a bit on opposite ends of how we're going to control this. I think we know if we're going to do it, this is the method we're going to be best successful, and that's setting up a specific space that we can do it. The best practice is to have consistent assignment with the staff. The staff are not shared. Equipment's not shared, med carts aren't shared. All of the stuff that you need for those folks should be unique to that area. So those of you that have facilities where you have a low census and you think you can do this, and you have staff committed to seeing this through, let us know. info@caf.org. Say, look, I've got this facility. This is the county I'm in. I think I can do this with 10 beds, and I think I could set it up in 48 hours. That's the kind of information we need to give to the counties in order for them to be able to make this actionable. Because if we don't, I'm not sure anybody at CAF is going to be able to stop the wave of people from all over the state that are going to come into buildings and aren't prepared for it. So if you are, please let us know your ability to help as soon as we can. So. All right, well, we talked about, gosh, all of these darn challenges, and I want to have some time for questions afterwards, but I asked Jocelyn Montgomery to come back and talk about it. She's done some fantastic work regarding psychological first aid and things of that nature. She's created a number of toolkits for our staff and helping them deal with residents that may be impacted, but I think Jocelyn also wants to talk about how we take care of us. So Jocelyn, are you there?
I'm here. Thank you. Thanks, Jason.
Thanks.
Yeah. Well, hello, everybody. I'm I am feeling very emotional at this moment myself because I've spent way too many years thinking about the impact of pandemic illnesses on long-term care. And, you know, we developed quite a few tools over the years, but we always prayed that we'd never have to use them. And here we are. A couple of things I want to say is you got this. It sounds completely overwhelming, but you've got this because you have dealt with flu outbreaks, norovirus outbreaks, heaven forbid, you know, TB, measles, who knows, scabies. You know what this kind of crisis is like. And so call on that knowledge. First of all, take a deep breath and call on that knowledge and know that this illness, 80% of the people that get it recover without even a hospitalization. So just take a deep breath and remind yourself of that, because what I want to talk about is how to cope with this intense stress. And we have excuse me, we have some resources already up on the CAF website if you haven't seen them. I think one of them's relatively new. The first one, which Jason has posted, has to do specifically with the coronavirus event or disaster, I guess we can call it, and how, you know, how that affects our emotional health. But the other one we did last year, which after the fires, we decided it was really time to acknowledge that there are interventions that work well to help people to ease their suffering, to help them calm down. It actually, you know, can speed their recovery after a traumatic event. And that's called psychological first aid. And we developed a module, PowerPoint, recorded audio, and some case studies for you to use with your staff so that you can use it with your residents, you can use it with your coworkers, and it will help you in your family too. So this is the first thing I want to say is this is an event where you need to acknowledge that the mental health impacts are pretty big. I mean, this isn't business as usual. None of us have ever lived through something like this, and 1918 was the last time the world saw something quite of this magnitude. So, so we are in a crisis situation. Unfortunately, it's a crisis that isn't going to go away very quickly, and that can have its own impact because we have our adrenaline. If it's a short-term event like an evacuation, you know, something that happens over the course of several days, you know, we deal with it and then we collapse when it's over, right? Well, this is a marathon. This is going to last a while, several weeks at least. So we got to protect ourselves and make sure that we're able to manage our stress, manage the events, and make good decisions. So some thoughts. First of all, we have three kinds of stress going on, you all on the phone and all the people that work for you. One is the kind of stress that a responder has, because you have to do all the things that Jason was just telling you. You have to deal with the residents who are going to be having their own impact from being isolated and having their routines turned upside down, and hopefully, you know, not being sick with the coronavirus. But even if they aren't sick, you know, the stress on them is increased. That's one kind of stress. You've also got survivor stress. So you're victims of this event. Every single one of us is a victim of this event. We see the empty streets, the schools are closed, the restaurants where we go, you know, have breakfast, brunch, Sunday brunch is closed. The societal hardships are hitting us personally. And then the third kind of stress that you probably have is as a caregiver for your family, for your elder parents, for the children that, you know, were shocked when school closed down, and hopefully, not, but for the spouses whose businesses have laid them off. So this is kind of like the well, what's the word? Perfect storm of stress. All right. So there are ways to deal with this. And I think the first thing to do is acknowledge that it is a big deal, that there are going to be people who are maybe not obviously showing the signs of the stress that they're experiencing right now, but are going through it. Maybe you're going through it. Everybody reacts to stress in a different way. If you take the course, you'll see the variety of symptoms, I guess, or manifestations that people commonly show when they are getting overloaded with stress. You need to watch for them in yourself. You need to watch for them in your family. You need to watch for them in your coworkers. And then the beautiful thing about psychological first aid is it gives you some very practical, easy techniques for helping people to calm down from that place. And it may not be intuitive. You may think, well, what you got to do is tell people to suck it up, tell people to cheer up, try and distract them, try and get them, to do something that will be cheerful. Yeah, all of that's great, but everybody needs a chance to talk to a trusted person about what's going on. They may not voluntarily do that, but if they're invited to do it, then they may, and that's very, very helpful. So we got to put it out in the open is my point. We shouldn't hide that this is taking a toll, that we're not sleeping well, that our stomachs hurt, that we're drinking too much, that, that it's starting to get us down. That's the first step, is acknowledge it and be willing to help each other. And if you need professional help, get professional help. And there are links for that in the psychological first aid module where you can find out how to get professional help if you need it. Most people won't. That's the first step. The next is get educated about COVID-19. So much misinformation out there. Limit your time on social media, please. Limit your time on TV, like, CNN and the other catastrophizing news outlets, because some of that information is useful and reliable and some of it's not. But in any way, shape, or form, you don't want to overdo it. Okay. You want enough information to be informed, like, if you eat COVID-19, it's not going to make you sick, right? So you don't have to worry about the food that you eat being contaminated, stuff like that. You need to know that people can spread it when they're asymptomatic. And so one of the things you do is you stay 6 feet away from other folks. And if you're in a public place, you make sure you wash your hands with hand sanitizer before you touch your face, even if nobody was coughing and you don't think anybody's sick. These are the kinds of practical information that you need to have and you need to share with your loved ones and your families. And then there are some great resources that CAF has put together for you in terms of running your business in a pandemic. And we've done a ton of things, sample policies for sick leave, different staffing configurations that Jason was just talking about, having a team of people who are fit tested for the limited N95s that you got, maybe the ones who have recovered from COVID-19 and are back at work, they're the ones that handle the wing where the infected people are. So even in your professional life, be informed, take the resources that are there and have a plan. That's going to help your anxiety. It's an antidote to anxiety to feel like you got a plan and you're not in this alone, and it's okay. You can manage it and it will be what it's going to be. What you can control, you control. What you can't, you don't, right? But you don't let yourself get too beat up about that. So then take this course, if you would. It's a 50-minute course. Just listen to it, think about showing it to your staff, so that everybody gets permission to talk about how they're feeling if they are feeling overwhelmed. And and the practical advice you can give them, you have an opportunity to give them when they're ready to listen. So think about taking the course, and maybe you'll offer it to your staff. And then the biggest, most important thing is devote time to yourself and your family so that you can heal and calm down and renew. You take a break right now, take a break from the media, take a break from your work, take care of your body, good habits, make time to unwind. Everybody's got a different way to do that. You got to find those activities, and you have to make time in the day to do that so you have the strength to face it another day. Connect with the people you trust and talk to them about your fears. It's okay. It's okay to talk about your frustrations. It's okay to talk about your fears, and it's therapeutic even if they can't fix it for you. In fact, I like to tell my husband, I'm getting ready to vent right now. Don't try to fix it. Just listen, right? Just let me talk. And I'm better. I don't need anybody to tell me how to fix that, but I needed to get it out. And many of us are like that. And then reach out if you do need more help than that. And the resources are there. There's a disaster mental health link that anyone can call. It's in the psychological first aid handout. There's county mental health. Don't be afraid to ask for help from your clergy, uh, your doctor. Get help to keep you strong. I read something yesterday about Dr. Fauci working 20 hours a day, and his wife has to remind him to eat and drink water. And I thought, well, he's a poor role model for us in healthcare, because you can't keep that up. You cannot keep that up. And God bless Dr. Fauci. I do not want him to go away till this is all over. So I want him to take care of himself, right? Same thing with you. And that's my message to you. Thank you so much. I don't envy you, but I so appreciate you, and you're the bravest people out there. I hope the resources you need to do your job safely are coming quick. So I'll turn it back over to you, Jason.
Thanks very much, Jocelyn. I appreciate that. And Jocelyn made some great points there. Some I'm going to take to heart as soon as this Friday ends. I'm going to turn off my phone for a day or something like that. But 100%, we all need to do that. We all feel, at least I feel like, I feel like Dr. Fauci. I don't have time. I'll rest when this is over. But it gets to all of us. So I think those are all messages we can take to heart. So before we go, I want to just reiterate to folks, CAF, what we're trying to do is collect all those resources. Jocelyn spoke about, getting enough information that you have the correct information, but not overwhelming yourself with constant COVID messaging. That gets old after a while. So I realize that we all have areas which we want to gather information, but to the extent that that CAF can weed some of that stuff out, we're going to attempt to do that. The guidance for this event has changed almost daily. At first it was only mask everybody, and then it was only symptomatic people, and now they're kind of going back to the other thing. There's a lot of unknowns with that. What CAF has done, and what we have a team of people doing, is reviewing all the CDC documents, all the public health documents, any local county documents that we can get our hands on. And we're going to update that daily on our website. So if you're looking for government related resources that in one spot, the link to all of those things, that is on the CAF website now, and it will continue to be there until this is over. So as you go onto the CAF website, there's a bright red kind of text box that says for information on the coronavirus, click here. And so that'll get you the information, most up-to-date information that you guys need. So what are we looking at for next week? For the next week in kind of response for our facilities. I think it's realistic to think, based on the movement that we're seeing in Los Angeles County, that the impact to some of these other counties is going to get pretty acute fairly quickly. These initial people that came to the hospital are now getting better and they're ready to be discharged. So in this next coming week, we anticipate seeing some of that surge that we've been talking about coming into SNFs. So now is the time to contact the county, the local public health, to let them know what your capability is for assisting. If you're completely full and you don't have PPE, or you've got 5 staff on duty or something like that, then obviously you're not in the category of being able to assist, because we anticipate that would probably exacerbate the problem. So that's just as important to let your local public health know that as well. Say, hey, listen, I don't have the capability to assist here. I don't have a separate wing I could set up. I don't have staff to meet it, and I don't have PPE to keep it from spreading. Those are the kind of things we've got to let them know, so that they can cross you off the list, or they can work to find those resources for you. Either way, I think it's good to let them know both things. So do we have questions? I'm not sure we have, if anybody added.
This is Courtney, DPP coordinator. We have 2 questions.
Sure.
Okay, so the first one, will this slideshow be made available afterwards? Yes, we'll send out the slides. And then we had another question, and I believe the person is asking, are we able to move patients without obtaining consent?
Gosh, I think on the, what was it, the 4th slide? Let me see if I can get back up to the 4th slide here. Right there. So under that AFL, the one that's 20-32 gives us the authority to transfer residents. So if you click on that link, not only can you transfer them, but you can also expand your licensed bed capacity. You can come up with an alternate care site within your building. It's pretty broad. It gives you a lot of options for creating space for COVID positive folks. And that includes moving people out. But like I said, before you do that, let's find out if the county needs those beds. If they don't, let's not inconvenience folks until the time is needed. But give yourself, realistically, how long is it going to take you to move all those folks? It's not an easy thing, because you have to move all their personal belongings, and all that other stuff has got to go with them. So give yourself a little time to accomplish that, but ask the county in which your facility is in, what's the need. If you can't get a hold of the county, or the county's not being responsive, talk to your hospital partners and ask them, what is the need that you guys have? Do you have 50 COVID people that are going to need long-term care, or do you have one person that needs long-term care? So that's really the question of when we start moving folks out. But at some point, our anticipation is we're all going to have to get to that point where almost every building, unless we can slow the rate of spread, or we can get these folks to be put into alternate care sites rather than SNFs, we all have to look at whether we can accomplish this and be realistic about staffing and PPE. Those are the 2 things that everybody's concerned on, and they're going to struggle with. So.
And we have one more question. Amazon has a program for PPE that is only open to acute hospitals and government agencies. Is it possible for CAF to work on getting SNFs included in that program?
Well, that's a good question. That's probably way above my pay grade. I'm not sure who negotiated that with Amazon, if it was directly like the executive branch of our government. But I think it's a wonderful thing, and I highly recommend you as partners. Like we all of us are in this together. We're all going to face it together. If you have resources and the folks down the street don't, you know, uh, share any knowledge that you have, any resources you have, staffing resources you have, PPE resources you have, even if they're non-traditional, unvetted resources. At this point, we've got to look at whatever we can do to protect our staff and the folks in the building. The current recommendation is to have all staff members have masks on. So I don't know where we're going to get these masks. I have no idea. But if you guys have non-traditional sources that you want to share, we have a CAF forum. I highly recommend you guys use that. Make it as robust as possible. Share information. That's what it's for. It's for you guys to go onto that forum and said, I had a great experience with this. I ordered from this vendor and they still have supply available. Those are great, helpful things that we could all do to help each other. We've started a list as an association of unvetted people. Obviously, it makes sense that we get hundreds of emails saying, I've got PPE for sale. It makes it difficult for us to be able to vet that because I don't want to give you that information and the person, it'd be some kind of scam or something like that. So we've not been able to vet everybody. So if you guys have somebody that you have already used that you would like to share that has access to PPE, any kind of PPE, whether it's gloves or ABHR or gowns or masks or N95 masks, whatever the case is, I suggest sharing that on the forum with each other. So.
And Jason, can you speak to the CDC comments about staff wearing face masks in a SNF? Is there any further guidance from CDPH?
No, there's not, and that came out this morning. That CMS, well, it came out midnight last night, but essentially this morning. So they probably not seen this, but it's pretty consistent with the MMWRs that we've been reading regarding the transmission of this virus by asymptomatic people. And there was a study done regarding the facility in Washington State where 13 of the people that tested positive did not show symptoms. So that was 57% of the people were shedding virus, but were non-symptomatic. So there was a study done in Singapore that was done a week after that showed that there was some transmission between asymptomatic people. And so based on those early studies, they're recommending that people wear masks. Anecdotally, we have heard from a couple of the clusters that have happened within the state of California that were brought into the building by a non-symptomatic healthcare worker. So a healthcare worker did not display symptoms. We obviously couldn't screen them out when they came into the building. So we weren't able to determine that they were contagious. And then we had, in one case, it was 15 folks in one building, and another case, it was 50 people in a building because a healthcare worker, non-symptomatic or asymptomatic, came in, and that was the point of entry into the building. So they've gone back and forth with this. It's not airborne. It's droplet only, but there's got to be some kind of fine aerosolized transmission when we speak or talk that they're concerned about. If you're in a 6-foot radius from somebody else, you need to be masked if you're a healthcare worker. That's the current guidance. It could change tomorrow, but if you have the ability to do it, with like a surgical mask, not necessarily an N95, but a surgical mask or some kind of cloth mask, I think that's great.
And we have another question. Just for clarification, should we isolate new admissions or readmissions as a precaution regardless of COVID status?
That's the most recent recommendation as of today. If possible, isolate all admitted residents, including readmissions, in their room in the facility for 14 days if their status is unknown. And so unless the acute did a test, then we're going to assume their status is unknown when they come back in.
Okay, one more question. When creating a COVID ward, can we temporarily set up curtains blocking egress?
Well, don't block egress outside the building. We can't do that because if a fire happens, we need to be able to get out. So, you know, it needs to have some egress out of that area, and ideally not through the other portion of the building. Ideally, the egress would go directly outside. Ideally, I realize I don't know the space that you're talking about. You may not be able to accomplish that, but if you do, don't you can't block the means of egress, but you could probably set up like a tarp or some kind of see-through plastic that could go on the wall. I'm not. I would have to look at the space, but if you call me after the webinar is over, I can give you some more specific information.
Okay, another person said, I was late to the webinar. Has AFL 2032 been rescinded with respect to the statement that SNFs may not refuse a COVID-19 admission?
No, it hasn't. And that's, gosh, you know, we saw that and we all freaked out, just like pretty much everybody that read this. There were some very concerning things. We anticipate there's going to be there could possibly be some legal action, not from us, but from the advocate side to get a temporary injunction to stop some of those elements of that AFL. But at the time, we're actively working on them. If for any reason you're getting a county or an acute system trying to force a readmission of a COVID positive patient back into your building, please send an email to that info@caf.org and let us know. We want to be in contact with those folks because based on the guidance, they have to make sure that you're prepared to deal with with those folks. And since we're going to treat these readmissions as a suspect case, then we need to have PPE to be able to deal with that. So I realize this is going to get out of control. We're going to have a bunch of people with a bunch of hospitals doing that. But if you've tried to coordinate with the county and the county's still trying to force these folks into your building, we want to know about it. Maybe there's something we can do. Maybe there's not, but definitely let us know to see if there's anything we can help with. Any other questions?
Okay. Yeah, we have a couple more. Let's see. Sorry, they're coming in and it keeps bumping it up. So to reply to your statement from the same person about the 2032 AFL, he says, I read that statement to mean that all the waivers in the AFL are conditioned on a willingness to accept COVID-19 patients.
Yeah, we saw that language in there, and they're gonna adjust that. That's for sure, because we know that the staffing problem is not just because you have COVID in the building. The staffing, the alternate care sites, all of those things have nothing to do with whether you're taking COVID into the building or not. So, but we will get that part corrected because that's not consistent with what we understood at the beginning.
Okay, and then our latest question, if we ask the staff to work with COVID-19 residents and they contract COVID-19, does this create a workers' comp nightmare?
Well, that part I don't know. I'm not an expert in that, but I think what we'll do for the next webinars to talk about some of those staffing issues. If you have a specific question about staffing, about the legally what would happen, what I'd like to do is if you could post that in the form of a question and send it to me at that info, send it to my attention at that info@caf.org, and then I will have our general counsel look at it to see if they waived any of the liability exposure for the employers if they ask somebody to work. I know there are certain requirements for nurses to work, but I'm not familiar with any of the other licensure categories that would relieve you of liability. So that's a great question. And if you send it to me in the form of a question, I will ask our general counsel if he can find an answer for that. And once we do, we can post that on the forum, because I think most people are probably going to have a similar question.
Okay, great. 2 more questions. So how do we screen dialysis patients?
That's a great question. That was covered slightly in the CMS guidance that came out this morning. Let me try to find it here, but it did talk about folks that go out for medical appointments. Well, why don't you ask me another question and I'll see if I could find the answer to this one.
Okay, our next question is, what is the best way to handle belongings coming with the patients?
Somebody asked that question on the forum the other day. It doesn't speak to personal property in respect to these folks, or at least that I could find, but it does talk about infection control on surfaces, on things that people touch, on the rooms in which COVID positive people or suspect people are. All of that says that you must disinfect those surfaces. On the CDC infection control link that's on there, there's a spot on there that talks about what disinfectant you can use for COVID-19. That's effective for COVID-19. So my suggestion is for you guys to take a look at that, and you can determine how you should clean those surfaces. If it's clothing or things of that, I would wear PPE to collect the clothing if the person's COVID positive or a suspect COVID patient, and then wash the clothing for them if you can. So that would be my suggestion, and then to disinfect any of the other stuff that has a surface that you can clean off. All right, so
Okay.
I'm still trying to find the information on what you should do when a person comes back after going out for a medical appointment. But I do know it's a long document, but there is a bullet point on there, and I'm trying to find it here, guys, about the guidance of what the resident should wear. Patients and residents who must regularly leave the facility for care should wear face masks when outside of their rooms. So it does not specify whether that person was a COVID patient. I think this just means any normal patient or resident who must leave regularly for dialysis. They just need to wear a face mask when outside the room, at least according to this guidance. So.
Okay, and then our final question, can CAF post the CMS memo?
Yes.
Because she's having trouble finding it.
It should be. I'll go to the CAF website right now just to double check to make sure it's up there. But I believe if you go to the CAF.org, you click on that, the coronavirus link, it should be bright red, visit here, latest developments, coronavirus, something like that. So CMS guidance, new infection control guidance for skilled nursing facilities. So that is on there right now. It should be the first link under the CMS information section.
Okay, and we had one more question just now.
Yep.
How should we go about screening EMS services? If they answer yes to the question, is it a possibility that you may have been exposed to COVID-19?
Yeah, so we have to assume that the EMS personnel is definitely a high risk folks. We're going to screen them before they come in the building. At least that's the current guidance, just like anybody else. For symptoms and things like that. And those folks should have access to PPE, and they should be wearing PPE when they come in the building. So I just want to reiterate, folks, there's a ton. I know there's so much information. We try to collate it and just keep it to the stuff that's applicable to long-term care, and we put it on one page. If you guys see resources or things like that that need to be updated or changed, we need to crowdsource this, because gosh, there's so many of us working 15, 16 hours a day that sometimes we don't catch everything. So if you guys see stuff, please let us know on the forum. Say, hey, listen, this came out. I think we need to update this on the page. If you guys learn of best practices or staffing resources or PPE resources, I highly suggest sharing it with your the folks that are around you here. We all got to get through this thing together. So we'll record these webinars. The webinars will go up fairly quickly afterwards on YouTube. So if you're staff or you want to, look for that link again or anything like that, this will go up on YouTube, and we'll do that every week until we're out of this thing. So good luck, guys. I want to thank you from the bottom of my heart for all that you guys do. All of us at CAF, even if we're not working in our office, we're all working at home trying to support you guys doing the best you can. So with that, I want to say thank you, and please email us if you have any questions.